Hello and welcome to today's webinar, Transform Collaboration in Healthcare with Microsoft. My name is Stephanie Galena and I'm a Senior Marketing Manager at Perficient. Before we get started today, I'd like to cover just a few housekeeping items. Today's presentation is being recorded and a link to the on-demand recording will be delivered to the email address that you provided upon registration. The on-demand webinar can also be accessed from the Insights section of Perficient.com once today's session is over. This resource offers guides, blogs, podcasts, and other content around our digital transformation. Also, we've provided resources that you can access during the event. Please take a look at the handout section of the webinar interface, and you'll find an overview of our Microsoft expertise and more details about our Healthcare Huddle app that we'll be reviewing today. So let's get started with a quick overview about Perficient. Whether you're joining us live or just viewing this on demand, we're thankful that you've taken time out of your busy day to listen in. We certainly want to get to know each of you better, and in the process, we're excited to introduce you to Perficient's people, capabilities, and successes. We are a global digital consultancy transforming how the world's leading enterprises connect with their clients in more meaningful ways and drive superior business results. We drive end-to-end success and bring a pragmatic approach to your digital transformation, delivering award-winning strategy, infrastructure, insights, experiences, and innovation. We help our clients gain the most value with our multi-shore delivery, which draws together the expertise of Perficient teams around the globe for agile collaboration that helps you quickly and cost-effectively scale resources and deliver better experiences. We support the brands that you know and trust and are especially proud of our 90% repeat business rate, as that number highlights the trust and collaborative culture we work so hard to build every day within our teams and with every client. Now a little bit about our healthcare expertise. Our dedicated healthcare practice is made up of experts who understand the unique challenges facing the industry, many of whom come from the payer or provider space and can help you champion change and transformation across your enterprise. We are trusted by 9 of the 10 largest health systems and by the 5 largest payers in the US. And Modern Healthcare this year has recognized us as the 4th largest healthcare IT consulting firm. A little bit about our Microsoft expertise. In addition to our great and deep expertise in healthcare, we're a gold certified and award-winning Microsoft partner. We have more than 20 years of Microsoft experience with more than 85 certified cloud consultants who are recognized experts that deliver solutions in cloud strategy, collaboration, application modernization, and more on the Microsoft cloud. Furthermore, Microsoft recognized Perficient as a finalist for its 2021 Healthcare Partner of the Year Award, and in 2020, we earned the Microsoft Health Innovation Award. A little bit about what you're going to hear today. We've got a great discussion lined up for you. We're first going to kick it off by learning about the expectations that's driving virtual health initiatives today. We'll then talk about the competitive innovation using the Microsoft Power Platform, followed by a demonstration of Perficient's Healthcare Huddle app, and we'll also explore use cases that spark the ideas for streaming collaboration within your organizations. We welcome your questions, so please, as we're presenting today, if you have any questions for our speakers, add them using the chat feature on your screen. We'll keep an eye out for comments, and with time permitting, we'll wrap up today's discussion with a Q&A. Of course, we also welcome a deeper conversation with you following today's call. Let me first introduce you to our speakers today. Joining us are Eric Schmidt, who's a director for Perficient's Modern Work practice and supports the pre-sales and delivery for Microsoft Teams and Power Platform solutions at Perficient. He has 19 years of experience delivering solutions in the Microsoft stack with a focus on business applications, process automation, collaboration solutions, and has built intranets for some of the world's largest companies. As a Midwest transplant living in Southern California, Eric enjoys riding his electric bike, camping, and fishing. Also joining us is Christina Kaufman. She's a senior business consultant on our healthcare strategy team. She plays a key role in helping Perficient expand its presence in the virtual health arena. She has over 14 years of clinical experience as a registered nurse in both inpatient and outpatient settings. She's been with Perficient for 3.5 years and has been involved in multiple Microsoft Power Platform healthcare projects that required her expertise as a seasoned nurse. She enjoys working with frontline healthcare professionals and helping to provide digital solutions that enhance operational workflows, along with improving patient safety and quality of care. And with that, I will hand the presentation over to our speakers. Christina, take it away.
Thanks, Stephanie. There's been a lot of change in healthcare since COVID became the catalyst in expanding healthcare's presence in the digital world. This slide outlines important statistics. As we all know, that COVID drove massive growth in virtual visits, at least tenfold the number of visits, with many of our providers seeing even higher growth rates. Just to give an example, one of our clients went from less than 100 virtual visits a week to 4,000 a day. Forrester and many others are forecasting that a substantial proportion of visits will remain virtual. This then changes the approach to in-person care as well, because you have to facilitate navigating in and out of a virtual care path, which you previously didn't need to do when only a small percentage of your traffic was virtual. At least 20%, maybe even 25% will now remain virtual. What is not obvious, but we have been anticipating for some time, is that acceptance and expansion of virtual visits is reinvigorating other parts of the virtual health market, about 25% or more in projected annual growth, which in the past had been a small but turbulent market for at least a decade. All of that activity means we have new experiences our healthcare professionals, members, and patients are increasingly looking for. And where you don't have those options or don't have engaging versions of those options, then it starts to become a point of differentiation. With healthcare's changed landscape, patients and providers expect more. We have to create solutions that fit the unique needs of the clinical world. Both patients and providers expect technology to create more than just virtual visits. They want a platform to easily communicate and manage health, whether it be through wellness programs, care team collaboration, communication between patient and provider, or remote monitoring. This is healthcare's new norm. Here we outline some of the major areas of healthcare where virtual health can really come into play for both patients and providers. We have personal digital health, which includes wearables such as heart rate, heart rhythm, blood pressure, and oxygen saturation devices that can then be incorporated into personalized care plans or remote monitoring. Community digital health, where we support population health through monitoring and prevention of disease states through digital tools. Monitoring and care coordination, remote monitoring that can help provide more insight into patient assessment, which enables medical interventions and preventative measures. Digital therapeutics, utilizing evidence-based software intervention apps that are intended to prevent or treat a disease designed for specific patient populations, such as major depressive disorder, obesity, smoking cessation, and much more. And of course, virtual visits between patient and provider to provider for when consults are needed. And last but not least, we have care professional digital workflow, utilizing digital tools to enhance clinical workflows and collaboration. And today we'll go through potential scenarios where Power Platform can support and streamline some of these operational workflows. The Huddle app is a great example of an innovative solution that is needed in healthcare today, because communication among healthcare providers plays a critical role in providing quality care. This also means interacting and collaborating with care teams, even when the teams are spread across different departments and provider systems. I'm sure you've either heard of the triple or now quadruple aim in striving to deliver better patient outcomes, better patient experiences, reduce care costs, and the latest, improving provider experiences. Our Huddle app solution supports all four goals. If you're not familiar with the concept, Daily Huddle is a quick 15 to 30-minute meeting to go over any issues, announcements, recognitions, and key metrics or KPIs among healthcare teams. Talking points are usually captured through whiteboards, SharePoint sites, spreadsheets, and other forms of documentation. So you have all this important information that is siloed by each team, unit, or department. There is no centralized view, and a lot of this information can be very beneficial to different teams, including management and leadership. Today, there's little competition in this arena. Some healthcare organizations create their own homegrown solutions, but they're still not able to be shared across the board. We are in a position to offer a product that is not only highly innovative, but is also comprehensive across one platform that can integrate with EHRs and other source systems. This not only improves patient safety and outcomes, but makes the lives of frontline workers easier.
Thanks, Christina. So today we're going to be talking about the Microsoft Power Platform. So just a quick run through of the components of the Power Platform that will be used by the solution. We're going to show some examples of a Power BI report. We're going to demonstrate a Power App running in Teams. So Power App is going to be the user interface of the application. We'll show some workflows running in Power Automate. And when we do things like create an issue, we're going to be storing the data in the Power Platform data tier, and that's called the Dataverse. So in terms of some of the value of the Power Platform, why are we using the Power Platform versus building a full stack solution, or what you may refer to as a full code solution? These solutions can be created for a fraction of the price, basically, in a fraction of the time. So in terms of what you're going to see today in terms of the application, there's very little code. It's a lot of configuration, and from a technical perspective, when you do get into the application and look at the code, it will look a little bit more like Excel formulas than, say, C#. We're going to show a number of different application concepts today. You'll see that they all look and feel familiar. So the applications are generally, Power Platform applications are generally intuitive, simple, and because it's a low-code solution, it's easy to continuously improve them. And an advantage of the platform as a whole are not only security and compliance capabilities built into the platform, but also tools that allow you to govern Power Platform applications created in your environment, so that the product allows you to view sort of who's viewing what access developers have to what data, the popularity of applications in your environment. So an advantage of the platform is really its governance capability and your ability to monitor what's going on. So some Forrester studies here we're citing on the right. Benefits over 3 years. The Forrester study found that there was a 502% ROI over 3 years with an 11-month payback period. So brief introduction into the Power Platform there. We're just going to go ahead and hop right into the demo. So here on the screen, you'll see that we're in Microsoft Teams. And our teams here represent different working units. So each channel may represent a different group. You'll see here we've given some of the groups or channels nicknames. So in addition, basically to the collaboration capability of Microsoft Teams, we're going to go through and show you how we can embed sort of custom applications, Power Apps inside of Teams to sort of drive more of your workflows into Teams. So when we talk about running Power Apps in Teams, what we're doing is we're sort of customizing Teams to meet your business, to meet the your workflows and some of the needs that are specific to your organization. So you see here we're in a channel. So just like any normal channel in Teams, we have ongoing posts, files, a wiki, whatever tabs we're used to using in Teams, and then we have our Huddleboard application. So I'll go ahead and launch that. So again, this is a Power App that we're running in a tab in Teams. So this is the Huddle application here. So these Power Apps can be sort of branded for your organization. Here we basically all the Power Apps you'll see here, we have sort of a purplish theme. So whenever we look at a Power App in our environment, it will sort of look and feel familiar. So Christina, did you want to walk us through the sections we're showing here on the application?
Sure. So, like I mentioned before, we have the issues section here, which is pretty important. These are any types of issues that we've kind of categorized as like workflow issues, staff issues. So workflow would be like new treatment protocols affecting patient care, staff issues, not having like enough nurses for night shift, or like not enough charge nurses. You could have like equipment issues, EKG machine is broken, there's not enough thermometers. Safety issues like increased patient falls. You can categorize any of the issues according to your healthcare organization. These were just some of the big ones that we thought we could kind of call out. So Eric, I think if you can click into one of the issues, we can show everyone kind of how that looks. So if we go ahead and create, maybe let's go ahead and create a new one. Yep, and so the person, so basically this allows all members to be able to go into the board and create issues or new announcements or new recognitions before Huddle. It also allows everyone to go into the Huddle board app during Huddle to add any new issues or announcements or recognitions. So if somebody wanted to come in here prior to Huddle, they can create a new issue. Yep, they can create the title, the due date as to when it needs to be resolved if they know. They can pick that category, which is what I mentioned before. We created categories, but this can be customized. And then they can add a description. And then the status is whether or not the issue is still open, if it's being taken care of, if it's resolved. So Eric, if you actually click on the urgent issue up there, we created this urgent button, which basically will send a message in the Teams channel to the appropriate assigned person or to the, we've created hierarchies. So if this was like a nursing unit and they had an issue that would then need to be escalated up to management, we've created this little button here, the switch button, where they can click on that. If it's an urgent issue, that next management tier or management team would receive a message in Teams outlined in red, kind of just showing them that this is something urgent that needs to be taken care of right away, sending them that message in Teams. So Eric, if you click save. And then if you can escalate that up to, so there's an escalate button that we've created here. So during Huddle, there's usually a Huddle leader. They would come in here and they'd have their screen pulled up here where they could then go through each of the issues that have been created prior to Huddle or during Huddle, and they can click that button there to the right that Eric, I believe you just clicked, that would then escalate that issue up to the next tier or hierarchy. So it could be management, or it can also be not only escalating issues vertically up the chain, but also horizontally. So if one nursing unit, like let's say the telemetry unit had an issue that could be, maybe it's shared across with the med surge unit, or, if you have different teams, not just clinical, but like patient access or revenue cycle, you can share, we provide the ability to share issues across the board, so horizontally and vertically. And then Eric, does that show?
Sure. And then when we did escalate that issue, we do send out email alerts. Basically that this issue was escalated to your huddle, to your team. In addition to sending out email alerts, we're also showing the capability here to ping the group in the escalation path directly from Teams. So when we escalated that team, the nursing leads team here, got a ping in Teams.
And then if we go back to
Going
that
back
link.
to the
Yep.
application, I think one of the really cool things we're doing here when we create issues in the system, we're of course saving those issues into a database. So we're creating a repository of issues that have occurred in our organization. So I think collecting this data has value. We'll be able to report on this data as the data set grows over time. I think it can enable us to see, trends in issues, and it can help to enable the organization to make some continuous improvements on their process. So here, I think the data we're gathering is valuable. Christina, did you want to discuss the announcements and recognitions features?
Yep, and so in addition to issues, a lot of teams discuss during their huddles, if there's any announcements. This can be hospital-wide announcements, like if a new nursing unit is opening soon, or there's a new EHR rollout, or it can be unit-specific announcements if there's like a new manager hired. So pretty similar to the issues option is where you can go in and create like a new announcement. Recognition, same thing. A lot of teams like to, do shout outs to team members, to colleagues who have gone above and beyond. And then also having the ability to possibly share some of those recognitions. You can click on here and you can create the ability to share recognitions across the board. You can share, with management if needed. So just whatever customized, whatever the healthcare organization would like to have it customized as. Same thing with announcements. You can share announcements across the board if needed. So our Huddle app does provide that potential to do that. And then there's also, like we mentioned, situational awareness. So this is usually like metrics, key metrics that are important to specific units. So our example here, we have like hospital census or patient falls, abandoned call rate if this is the call center. So just allowing that ability to really customize per unit or department or team.
And when we go in and we discuss, the Huddle app in organizations, oftentimes we find that the data sources are disparate. So we have data in spreadsheets, data in Access databases, data in third-party systems, data sort of transferred through word of mouth. So one of the things that we do is we take basically an inventory of all the data points that would be useful in the huddle and plan for some automation here long term. So in addition to the screen here we have in the initial dashboard, in the future we may find it beneficial to go into greater detail, let's say on the COVID trend or the hospital census, through the creation of additional Power BI reports. Here's an example Power BI report if you're not familiar. So the Power BI reports can help us to visualize our data. For instance, if we look at this report here, we see information about the bed count. And we also have some additional information here in terms of the COVID patients as an example. So as we start to gather what are really our main data points that we need to review on a daily basis, we talk about would there be value in us going a bit further, helping to elaborate on some of that data in these meetings. So Christina, before we move on, any other points you'd like to make on this screen?
No, I believe you've captured the main points that we've come across for Daily Huddle.
All right. So in terms of when the huddle is actually executing, when people are sort of in the huddle, if a user is remote, they may join a Teams meeting here, and the organizer would go ahead and share out the huddle board. And then in the right here, you see an example of an application running in Teams. And this application will allow the attendee basically to create an issue or an announcement or a recognition from their desk while they're participating in the huddle, and then it would, refresh on the screen. So part of the huddle concept is that everyone on the team will be able to add an issue to the board for discussion. One more item here, in addition to the view here that we're seeing, we also have a mobile app that the user can launch from Teams that allows the attendee to enter in an issue on their mobile device. So this is, of course, a desktop view. But if the user was on the go, and they wanted to run the Power App in Teams on their mobile device, they would, of course, launch Teams and then click on the mobile app. In here, we can do things like add an issue or add an announcement.
Eric and
Just
Christina, before we move on, I noticed we have a question from our audience, and I wanted to make sure we brought that up. The question is the solution integrated with an EHS solution?
So the initial version we're showing today is meant to be standalone. So we're about to discuss some items in the roadmap, but this is thought to be sort of a first Power App that would be deployed in your environment. So here we're setting up the Power Platform. We're getting users to use the Power App in Teams. And then in the future, we may integrate this integrate with additional data sources, including some data from your EMR and those additional data points that we talked about for situational awareness.
Thanks, Eric. That's all we had at this time.
Great. Well, moving on here. So just from a high-level technical perspective, what do we need to deploy a solution like this? So first, of course, we need to deploy Teams. So oftentimes when we're talking about a Power App like the Huddle app, the organization has already deployed Teams, and with varying levels, you're using it for collaboration. So we may have those teams already set up, and we may not. So part of this conversation is, how well is my business basically using Teams as a collaboration platform. So this could be done in parallel with the Teams rollout. Most often, this is done after a Teams rollout. So after Teams is up and running, then typically we're deploying some initial Power Platform solutions like the Huddle app here. And then today, you saw us creating some data in the Dataverse. And then as the platform grows, you may see us start to bring in additional data points into the conversation. So we talked about bringing in data from third-party applications and spreadsheets that would be useful in that huddle conversation. And I think you can also see the value of us bringing in additional data from the EMR to help to drive those huddle conversations, and also help us to create more complete Power BI reports that the team can take advantage of. Long-term, we may find value in deploying Dynamics CRM to help create a 360-degree view of the patient. So in terms of our solution stack here, how do we integrate with EMRs? We'd like to use the Azure API for Fire, and then synchronize some data into the Dataverse, some of the Fire objects there. So the first phase of this is sort of lightweight, get us up and running, and then this data integration here would represent a long-term solution that we'd evolve into. So speaking of data and aggregating some of our data here, we have a little quote. The evolution of healthcare will be characterized by a re-engineering of clinical care operations around digital health and a pervasive real-time use of data and advanced analytics. So the conversation here is, once we have brought in more of the data onto the platform, what types of additional solutions can we create? So we have a couple of solution concepts to share with you today. The first being the bedboard.
Great, thanks, Eric. So communication about patient admissions, discharges, and transfers can be done face-to-face or through outdated mechanisms such as pager and phone. This creates constant back and forth between different hospital unit nurses and house supervisors. It can take up valuable time that can be used on patient care because it's not real time. And important things often do change last minute in the hospital environment. And so that's why capturing real-time data is super important. Having a centralized place for nurses to update and communicate potential discharges or transfers is crucial to patients being admitted or transferred to different units. Bedboard allows real-time updates that can be made by individual nurses and house supervisors. It can create visibility, allowing for easy patient admissions and placement. We've created a granular view down to the actual room number so that charge nurses, floor nurses, and house supervisors can anticipate when and what room will be or is currently available so that transfer can be arranged and nurses can give patient report. So we've created a hospital-wide view of different units and rooms that either have the potential or current availability to take on a new admission. Next, we have this unit-specific view that allows individual nurses to update the board because they're the ones who will know when and if a patient has been discharged or transferred to another unit. Another consideration that's important is whether or not the room is cleaned and actually ready for an admission. The patient might be discharged and gone, but if the room is not ready, then it's still technically not available. So each individual unit board can then feed into a main hospital-wide board with the ability to drill down further if needed. Our solution provides a centralized board that is easy to view and allows all available and potentially available rooms that then allows the house supervisors and charge nurses to assign the exact room where an admission will go. Epic and Cerner have similar capacity dashboards, whereas our potential use case here could be used in conjunction to provide an easy and quick view that can be communicated across teams so that charge nurses and floor nurses can anticipate who the admitting nurse will be and what exact room number the patient will go to. This use case is what we call patient care team assignments. So nurses and other hospital staff are assigned a patient assignment at the beginning of their shift by the charge nurse. This is usually based on a patient's admitting diagnosis and how acute or sick a patient is, meaning they require more monitoring and care. Factors taken into account include patients with dementia who are prone to falls, patients who will undergo surgery and need a lot of prep and education, patients with critical IV infusions requiring constant monitoring, and patients who are getting ready for discharge. Assignments are usually written on paper or on a whiteboard. The charge nurse will go to each individual nurse and staff and get updates on their patients, which helps them create assignments. But patient assignments can change at any second. A stable patient can become unstable, meaning a heavy patient requiring more monitoring and care. So having a digitized and centralized real-time view can let other care team members know if a nurse might need extra help or who would be first in line for an admission if their patient load is light. Each individual nurse will have the ability to update their patient load as needed. Whereas before, the charge nurse had to make their way around the unit asking each nurse for updates. This then saves valuable time for the nurse, allowing them to do what they do best, provide quality care to patients. And we've color coded it here to make it really stand out as to which nurse might need extra help versus, who would be open for a new admission, green being that this person has that light load, yellow being moderate. Here we have shift change. So basically, we call it patient handoff. So with collaboration playing a critical role in the clinical world, having a central place for nurses to view and update patient report for the next shift is huge. Nursing report is usually verbal and in some cases recorded. Depending upon the type of nursing unit, some nurses might have to give report on 5 or 6 patients, and a lot of times it can be to multiple nurses. So nurses end up waiting for other nurses to either give or receive report, and this can eat up valuable face time with patients. Why not have a central place to document and update nursing report in teams? Then all nurses can see important patient information and what exactly happened during the last shift and what still needs to be done. Allow the ability to integrate with the EHR to pull in patient data and create a template in Teams where nurses can provide updates. Nurses can also update their patient acuity, which could then feed into that patient assignment board. Teams can also allow nurses to connect virtually, saving time trying to find nurses on a unit to give or receive patient reports. Here we have a medication treatment calculator. We provide an example of where we take a medication algorithm or dosage calculation that requires extra time and cognitive input from the nurse, taking away valuable patient face time and the potential for medication calculation errors. Our solution is customizable to complex medication treatment protocols, taking cumbersome and confusing if this, then do that workflows and simplifying them into easy to understand tasks that can keep a running log of medication calculation changes and completed tasks for auditing or history review. The calculator app also allows for alerts and color coding to capture the nurse's attention when it comes to critical lab values. The calculator app can integrate with EHRs, such as Epic, through a custom connector, pulling in lab values and physician order sets so that the nurse doesn't have to toggle through different tabs within the EHR to find exactly what they need. The example we provide here is a medication called heparin, which is an IV anticoagulant, otherwise known as a blood thinner, that is used in hospital settings. If not calculated properly, it can cause a patient to hemorrhage or not get a therapeutic amount to treat blood clots, which can be life-threatening. The medication calculator app can be customizable to any medication or treatment protocol, such as sepsis, stroke, or acute coronary syndrome. It can also be used in the outpatient setting for diabetes treatment with oral hypoglycemics and insulin, and for oral anticoagulants such as warfarin. And I know I've run through this pretty fast, so I don't know if there's any questions or where we might want to go back and take a look at some of these potential use cases.
Excellent point, Christina. Yeah, we've reached the end of our presentation, but we would like to open it up now for questions. If there's any questions about anything you saw within the demonstration itself or about the solution, we have some time to address some of those questions that may be in your mind. And feel free to put those in the chat and we'll read those aloud to Christina and Eric to address. So while we're waiting for that, I do want to queue up one particular one, and that is, whether or not, what is it about this Healthcare Huddle app, and is it HIPAA ready to address some of the, issues that we know of around compliance?
Sure. So the solution is HIPAA ready. So the Power Platform and the rest of Office 365 was built basically from the ground up with security and compliance considerations in mind. In addition, when we talk about doing the EMR integration, the Azure API for Fire was, of course, created specifically with security and compliance considerations in mind.
Excellent. We've got another question that came up about, could you kind of walk through again when this Healthcare Huddle app would be a fit over EHR solutions that an organization might already be using?
So Christina, did you want to take a shot, or I could take that one?
Sure. So I mean, our Huddle app solution, I think is what really differentiates it from utilizing the EHR for something along these lines is that it is easily it's simple, it's easy to use, it's communicated across teams. It is able to integrate those important data points from the actual EHR like Epic or Cerner, and it takes all that important information and it feeds it onto a simple platform that a lot of times that a lot of healthcare team members are already using, teams to communicate. And so I think being able to provide that simplified, easy to use view across the board that is able to pull in that important information from different source systems is what differentiates our Huddle app, because it can take into different source systems, not just data taken from the EHR, but other source systems too. And I think having that platform and that ability for the entire healthcare team to communicate and collaborate across the board is important.
And the solution is, lightweight, like we talked about earlier. It is a low-code solution, so customizing the solution explicitly to, for your business workflows and your business environment. It's quick for us to do so. And then the Huddle app here, it's thought to sort of be perhaps the first of many Power Apps that can help your teams become more productive.
I know we saw in the presentation a little bit about particular use cases. Would you, either one of you, elaborate about, an ideal target audience for this type of solution within a healthcare organization?
Sure. So what we've found is our targeted audience would most likely be a chief medical officer, chief nursing officer, chief operating officer, if there is a chief patient experience officer, and clinical nurse educators, managers, along with really working with frontline workers such as staff nurses and actual providers, and also working alongside with the director or manager of clinical operations is kind of that target audience that we would definitely be working with.
Excellent. Another question here we got is, do we have any other provider-based app examples that you two might want to talk to?
Um, Provider-based app examples, what outside of Microsoft or within Microsoft that we've kind of gone over potential use cases here. Just wanted to clarify.
Yeah, that might be a question that we redirect and take that offline. I don't have that information sitting in front of me at the moment. Yeah, we'll follow up with you offline about that. Thank you. We are all good with the questions. So Eric, Christina, really great information that you presented today. Just want to close and thank everybody for taking the time to join us today. And as mentioned earlier when we got started, you'll get a follow-up email this week that includes a link to the recording and the presentation slides we've shared here. And we welcome an ongoing conversation with you and encourage you to learn a little bit more about the innovative work that we're doing with healthcare and Microsoft solutions. Just a few links here, this is content related to news and great things that are going on in the healthcare and Microsoft space. And feel free to follow Perficient on our various social media channels as we're continuously sharing great information, client successes, et cetera, in the healthcare space. So on behalf of everyone here at Perficient, thank you for joining us. We hope you stay safe and enjoy the remainder of your day. We look forward to talking to you soon.